Hello everyone, in today's video, we will explore 5 familiar foods that seem harmless but can actually reduce or increase the danger of the medications you're taking. 1. Grapefruit, the golden fruit that can turn into a hazard. If you're on medication, I eat grapefruit every day because I think it's good for the heart and weight loss. But during a checkup, the doctor said my cholesterol medication was no longer effective. This is not an uncommon story. In fact, grapefruit and grapefruit juice are among the healthiest foods, but can cause the most serious drug interactions, especially in the elderly who often use multiple medications for chronic diseases. The question is, why can a nutritious fruit like grapefruit become harmful when taken with medication? The answer lies inside your liver, which acts as the processing factory for all drugs introduced into the body. In the liver and small intestine, there's an enzyme called CYP3A4, which plays a crucial role in metabolizing and breaking down drugs. This step is essential for the drug to work properly and not linger too long in the bloodstream. However, grapefruit contains a natural compound called furanocoumarin, which strongly inhibits the CYP3A4 enzyme. When the enzyme is inhibited, the drug cannot be metabolized normally. As a result, the concentration of the drug in the blood increases abnormally as if you overdosed, even though you followed the doctor's instructions. What's more frightening is that this is not easily noticed right away. People on medication may only feel more tired, dizzy, have muscle aches, or digestive issues, vague symptoms that are easy to overlook, while the body is being overloaded by undigested medication. Among the drug groups most seriously affected by grapefruit, the first group to pay close attention to is cholesterol-lowering drugs, commonly called statins. Familiar names such as simvastatin, atorvastatin, and lovastatin are in this group. When used with grapefruit, the statin levels in the blood can increase by 3 to 15 times. The result is an increased risk of muscle pain, liver damage, or even rhabdomyolysis, a rare but extremely dangerous complication that can lead to kidney failure. Many elderly people have found themselves in this situation. A 68-year-old patient once shared, "I took simvastatin every night but ate half a grapefruit every morning. When my limbs started aching severely, the doctor asked about my eating habits and finally discovered the cause." The second group is blood pressure and heart medications, especially calcium channel blockers like amlodipine and felodipine. Using grapefruit while on these medications may cause the drug to act more powerfully than intended, leading to sudden drops in blood pressure, dizziness, or fainting, particularly dangerous when standing up after sitting or lying down for a long time. Some antiarrhythmic drugs like dronedarone are similarly affected, increasing the risk of severe heart rhythm disturbances. The third group is anti-anxiety or mild sedatives, such as alprazolam, commonly known as Xanax, diazepam. When taken with grapefruit, these drugs linger longer in the blood, causing excessive drowsiness, confusion, slowed reflexes, and increasing the risk of falls, especially in elderly people who already have diminished reflexes and balance. A dangerous misconception is that just eating grapefruit a few hours apart from medication is safe. However, this is a risky misunderstanding. Grapefruit's enzyme inhibition effect can last from 24 to 72 hours after consumption. That means, if you eat half a grapefruit on Monday morning, your medication taken on Tuesday afternoon or Wednesday morning can still be affected. Therefore, whether you eat grapefruit a few hours apart from your medication or only a few times a week, the risk of interaction still exists if you're taking the drug groups mentioned above. Advice for older adults: if you're on statins, blood pressure medications, anti-anxiety medications, or heart drugs, avoid grapefruit and grapefruit juice entirely while on medication. This applies to fresh grapefruit canned juice, detox drinks with grapefruit peel, or products with grapefruit extract. Also, always read the medication instructions or labels carefully. If there's a warning line saying "do not take with grapefruit" or "avoid grapefruit juice," strictly follow it. If you've accidentally consumed grapefruit while on medication, do not stop or adjust your dosage on your own. Inform your doctor to be monitored and have the medication changed if necessary. Some may ask, can grapefruit be replaced with another fruit to maintain a healthy diet? The answer is yes. You can choose low-interaction fruits such as sweet oranges, apples, watermelon, or kiwi, provided you're not on potassium or heart-sensitive medications. The key is to diversify fruit sources and not eat only one type too frequently. In summary, grapefruit is a nutritious fruit, rich in vitamin C and antioxidants. But for those on medication, especially those over 60 treating cardiovascular issues, cholesterol, blood pressure, or anxiety, grapefruit can be a double-edged sword. Be alert to the seemingly harmless appearance of a familiar fruit, because the wrong combination of food and medicine can have silent but serious consequences. 2. Milk, the bone-strengthening drink that can block antibiotics. Milk is often considered a superfood for bones and a source of protein and calcium. But very few people know that milk can block certain medications, especially antibiotics, and render them ineffective. Why does this happen? The key lies in the calcium present in milk and dairy products. Calcium is a mineral that's very active. It easily binds with other substances, including the active ingredients in some medications. When calcium binds with the drug, they form a complex compound that is too large for the intestinal wall to absorb. As a result, the drug passes through the digestive tract and is excreted without being absorbed into the bloodstream. Effectively, you're taking the medication for nothing. One of the most typical drug groups affected by this interaction is the tetracycline and fluoroquinolone antibiotics such as doxycycline, ciprofloxacin, levofloxacin, tetracycline. These are strong antibiotics often prescribed to treat respiratory infections, urinary tract infections, or skin infections in older adults. For example, if you take ciprofloxacin with a glass of milk, the bioavailability of the antibiotic, meaning the amount that actually enters your bloodstream, can decrease by 30–40. This can cause the infection to take longer to heal or even become antibiotic resistant. A true story from a hospital. An elderly woman was admitted with a urinary tract infection and was prescribed levofloxacin. But after 5 days of treatment, her symptoms didn't improve. When the doctor asked about her eating habits, she said, "I drink a glass of milk every morning to keep my bones strong." That's when they realized the antibiotic was not being absorbed. It's not just milk. Dairy products like yogurt, cheese, butter, calcium supplements, or even calcium-fortified orange juice can all cause this interaction. So, what's the correct way to take these antibiotics? Doctors recommend that if you're using antibiotics such as doxycycline, tetracycline, ciprofloxacin, or levofloxacin, do not consume any milk or calcium-rich foods for at least 2 hours before or 4–6 hours after taking the medication. This time gap helps ensure the medication is absorbed into the blood before calcium has a chance to bind to it. Also, be aware of multivitamins or supplements that contain calcium or magnesium. They can cause the same issue. Always check the ingredient list and avoid combining them with these antibiotics. Important note: not all antibiotics are affected by milk. For example, amoxicillin or cephalexin are less affected. However, when you're prescribed any antibiotic, it's safest to ask your doctor or pharmacist, "Can I take this with milk or dairy?" Don't assume based on previous experiences. In conclusion, milk and dairy are nutritious, especially for older adults. But when taking certain medications, especially strong antibiotics, they can silently block the drug's effectiveness. Therefore, timing is critical. Avoid drinking milk or consuming dairy around the same time as taking antibiotics, especially tetracycline or fluoroquinolone, to ensure the drug works at its best. 3. Green vegetables, rich in nutrients, but can neutralize blood thinners. Green leafy vegetables are always recommended for a healthy diet, especially for the elderly. They are rich in fiber, antioxidants, and vitamins. But few people know that these very vegetables can interfere with one of the most commonly used medications for seniors, blood thinners. We're specifically talking about vitamin K-rich vegetables such as spinach, kale, collard greens, mustard greens, Swiss chard, broccoli, and even green tea. Why is this important? Because vitamin K plays a key role in blood clotting. That's precisely the process that blood thinners, also called anticoagulants, are trying to slow down. The most common blood thinner is warfarin. This drug works by blocking the action of vitamin K, thus reducing the blood's ability to clot, which helps prevent dangerous blood clots, strokes, or heart attacks. But if you suddenly consume a large amount of vitamin K, it can reverse the effect of warfarin. That means your blood becomes more likely to clot, increasing the risk of a stroke or blocked artery. Many people mistakenly think, vegetables are good, I should eat as much as possible. That's not wrong, but when you're on warfarin or similar medications, consistency is more important than quantity. Doctors often advise, don't avoid vegetables altogether, just don't change your intake drastically. For example, if you normally eat a small bowl of cooked spinach twice a week, that's fine. But if you suddenly decide to go on a green smoothie detox and drink kale juice every day, that can be dangerous. A real case from a clinic. A 75-year-old man who had been taking warfarin for atrial fibrillation suddenly developed chest pain. When examined, doctors found a blood clot had formed. When they asked about his diet, he said, "Last week I started drinking green juice every morning. It's all natural." That green juice was packed with kale and parsley, both extremely high in vitamin K. Important: warfarin users should maintain a steady intake of vitamin K, not eliminate it. It's a good idea to make a list of the green vegetables you regularly eat and how often, then stick to that routine. Always inform your doctor if you're changing your diet, starting a new supplement, or trying a detox plan. Other blood thinners like rivaroxaban Xarelto, apixaban Eliquis, and dabigatran Pradaxa are less affected by vitamin K, but it's still worth discussing with your physician. In conclusion, green vegetables are an essential part of a balanced diet, but when you're on warfarin or similar medications, sudden changes in vitamin K intake can quietly reverse the effect of the drug, increasing the risk of stroke or heart attack. The key is not to avoid greens, but to be consistent in your intake. 4. Bananas are good for the heart, but if you're taking heart medications, read this before eating. Bananas are a familiar fruit, dubbed a superfood thanks to their rich nutrients like vitamin B6, fiber, antioxidants, and especially potassium. For healthy individuals, potassium helps regulate blood pressure, balance electrolytes, and support heart and muscle function. But for those being treated for cardiovascular diseases, especially those on ACE inhibitors or potassium-sparing diuretics such as spironolactone, potassium can become a double-edged sword. In this article, you'll learn why a banana, a glass of orange juice, or a refreshing coconut might be dangerous when combined with certain medications, and how to eat properly and safely while still getting enough nutrients, potassium, and essential mineral. But easy to overdose silently. Potassium plays an important role in nervous system function, maintaining a regular heartbeat, and helping muscles contract smoothly. When you eat a banana, a potato, or drink orange juice, coconut water, you're consuming a significant amount of potassium. For healthy individuals, the kidneys handle excess potassium and excrete it through urine. However, in older adults or those being treated for heart disease or high blood pressure, this mechanism can be impaired, especially if you are taking ACE inhibitors such as enalapril, lisinopril, or potassium-sparing diuretics like spironolactone. Excessive potassium from food can lead to a condition called hyperkalemia. Hyperkalemia, the silent killer. Hyperkalemia is a condition where potassium levels in the blood exceed safe limits. In mild cases, you may have no symptoms, but when potassium gets too high, it directly affects the electrical activity of the heart, causing arrhythmias, palpitations, or unusually slow heartbeats, muscle weakness, tingling in the limbs, fatigue, shortness of breath, risk of sudden cardiac arrest. The danger is that the initial symptoms are often vague or unclear, causing many people to overlook them. By the time it's detected, it may be too late. Some cases have been reported where patients had to be hospitalized urgently just from drinking coconut water daily while on blood pressure medications. Healthy foods that are surprisingly high in potassium. You may be surprised to learn that many everyday healthy foods are actually very high in potassium. Here are some foods to limit if you're taking the aforementioned heart medications. Bananas. One medium banana contains about 400 for 50 mg of potassium. Orange juice. One glass can contain up to 500 milligrams of potassium. Coconut water. 1 cup to 5 ml contains about 600 milligrams of potassium. Sweet potatoes. Potatoes. A medium one can contain more than 500 milligrams of potassium. Pumpkin. Avocado. Tomatoes, spinach, beans, nuts, soybeans, lentils, milk, and dairy products. You'll notice that most of these foods are healthy and nutritious, yet they're on the watch list. That doesn't mean you have to eliminate them completely from your diet. So how should people taking heart medications eat? Not completely banned, but potassium intake must be carefully controlled if your doctor hasn't told you to avoid these foods completely. You can still eat bananas, oranges, potatoes, but in limited amounts and space throughout the week. For example, instead of eating one banana every morning, have half a banana every other day. Avoid consuming too many potassium-rich foods at the same time. Example, eating a banana plus drinking coconut water plus having pumpkin soup in one meal is the fastest way to cause a potassium spike. Choose 1-2 items and rotate them daily. Be cautious when feeling tired, loss of appetite, or drinking less water. The kidneys excrete excess potassium. If you're drinking less water, sweating a lot due to heat, fever, diarrhea, kidney function can decline, leading to potassium accumulation in the blood. Get regular blood tests. Check electrolytes. Measuring blood potassium K+ during regular tests is extremely important for those on heart medications. This is the only way to detect hyperkalemia early, even when you have no symptoms. Always inform your doctor what you're eating. Many people don't tell their doctor about their diet, thinking it's not important, but with medications like enalapril, lisinopril, spironolactone, your diet determines the effectiveness and safety of the medication. 1 glass of coconut water a day may be normal for one person but a potential danger for another. 5. Coffee and green tea. Good for your health or a troublemaker while on medications? Do you have a habit of drinking coffee in the morning or sipping green tea after lunch to stay alert and aid digestion? For many older adults, this seems like a harmless daily routine. However, if you're taking medications for osteoporosis, insomnia, anxiety, or other chronic illnesses, caffeine in coffee and green tea may silently reduce your medication's effectiveness or cause unwanted side effects. In this article, you'll learn about the not-so-simple relationship between caffeine and medication, something many people overlook. More importantly, you'll learn how to drink coffee or green tea correctly to enjoy their benefits without harming your health. Caffeine, the body's stimulant, but easily causes chaos. Caffeine is a natural stimulant found in coffee, green tea, black tea, cocoa, energy drinks, and dark chocolate. When consumed, caffeine stimulates the central nervous system, helping you stay awake, reduce fatigue, and improve concentration. However, it can also cause palpitations, anxiety, insomnia, trouble sleeping, fast heartbeat, mild increase in blood pressure, increased stomach acid production, increased calcium excretion in urine. In younger people, the body often adapts better. But in older adults, especially those on long-term medication, caffeine can interfere significantly with drug absorption, distribution, or metabolism, leading to dangerous interactions. Medication groups affected when combined with caffeine: anti-anxiety, sleep medications, sedatives, antidepressants. Some drugs like diazepam, lorazepam, amitriptyline work by calming the nervous system, helping the patient relax and sleep. Caffeine does the opposite. It stimulates the brain, causing alertness and excitement. If you take a sedative then drink coffee or green tea, the two substances compete in the brain. The result: the medication loses its effect, and you still feel anxious, jittery, poor sleep, waking up in the middle of the night. Some people even stay up all night after taking a sleeping pill just because they drank coffee in the afternoon. This is one reason many older patients complain that sleeping pills don't work, without realizing the real culprit is the strong tea or coffee after dinner. Osteoporosis medications, for example, bisphosphonates, alendronate. Caffeine can increase calcium loss via urine, reducing bone density if consumed excessively. Moreover, some osteoporosis drugs like alendronate, risedronate need to be absorbed through the small intestine. If you take the medication along with or right after coffee or green tea, caffeine and tannins in tea can block absorption, making the drug less effective over time, weakening bones and increasing fracture risk. Some antibiotics, thyroid medications, heart medications, although not everyone is severely affected. Caffeine can alter the absorption and elimination of certain drugs such as quinolone, antibiotics, ciprofloxacin, norfloxacin, thyroid medication, levothyroxine, certain antiarrhythmics. Depending on the drug, caffeine can increase or decrease treatment effectiveness, causing unwanted side effects. So how should you drink coffee and tea while on medication? Here are some principles to help you enjoy coffee or tea while ensuring your medication remains effective. Never take medication with coffee or tea. Always use water to take medication. Caffeine, tannins, and other active substances in coffee or tea can precipitate with drugs, making them harder to dissolve or absorb. The habit of morning meds with coffee seems harmless but is a common mistake. Separate medication and caffeine by at least 1 hour. If you take your medication in the morning, wait at least 1 hour before drinking coffee or green tea. This allows time for the drug to absorb before caffeine interferes. Conversely, if you've already had coffee or tea, wait at least 1 hour before taking medication, especially those needing an empty stomach like thyroid meds, osteoporosis drugs, or antibiotics. Avoid coffee after PM. The older you are, the longer your body takes to eliminate caffeine. Drinking coffee or tea after PM increases the risk of insomnia, especially if you're on sleep aids. Disrupted sleep brings many consequences: fatigue, poor appetite, forgetfulness, even falls due to nighttime grogginess. Choose milder coffee. Lower caffeine if you really enjoy coffee. Consider switching to decaf or a more diluted brew. For tea, choose chamomile or non-caffeinated herbal teas. Good for digestion and medication friendly. General advice for older adults when combining food and medications: always consult your doctor or pharmacist before introducing a new food, especially supplements or juices. Never take medications with milk, juice, tea, or coffee. Only use plain water. Keep notes or take photos of daily meals if you're monitoring lab values like blood sugar, inner, etc. Avoid overconsumption of any one fruit or vegetable, even healthy ones, as imbalance can be harmful. Separate medication and special foods: milk, grapefruit, green vegetables, by at least 2 hours to reduce interaction risks. If you find this article helpful, please share it with family and friends, especially older adults on medication. A little correct understanding can prevent serious health consequences or even save a life.